We are just getting everyone in, and then we will have Kathleen and Em start their presentation. Just kind of getting settled. Thanks for joining us. Hi, everyone. Thanks for joining. We'll give it maybe another minute or so, and then we'll go ahead and get started, and Em and Kathleen will share their presentation. Thank you so much for joining us. Awesome. I think we're gonna go ahead and get started. Thank you all so much for joining us. I am so excited to have Kathleen Hopkins and Em Ostrowski here to present their research to us. I'm Erin, pronouns she, hers, and we have Rita Rochelle, she, her as well, who is managing the Zoom room, making sure the tech is running smoothly. You're all muted now, but if you have any questions during the Q&A session, please feel free to unmute. You can also use the chat box if you have any questions or need anything. If you are comfortable doing so, please add your pronouns to your Zoom name by clicking the three dots on your video square and selecting rename, and then you can go ahead and put your pronouns in there. We will have one presentation during the session. They will present for 25 minutes or so, and then there will be about 10 minutes for Q&A afterward. I'm really excited to learn how data science is being used in innovative ways to address systematic issues like food insecurity. So I will now turn it over to Kathleen and Em to present tackling food insecurity through public data and local partnership.
Thanks so much. All right, let's get our slides up, then I'll start. Okay, thanks, Em. Hi, as Erin mentioned, my name is Kathleen Hopkins, and I'm joined by my colleague Em Ostrowski. We're so excited to be here with you today and to share the tool that we created in partnership with local stakeholders to tackle food insecurity. Our organization is Trenton Health Team, a regional health hub in Trenton, New Jersey. Our mission is to improve the health of our community through cross-sector collaboration and convening local partners. Next slide, please. As I'm sure we all know, food insecurity is a multifaceted issue that has been trending upward in recent years. There are many social determinants of health that are intertwined with food insecurity. And while there are a lot of great organizations working to fight this issue, it can be hard to know exactly how to address it and how best to deploy available resources. We decided to create a tool to try to answer this tough question and guide frontline action and resource alignment across communities. Next slide, please. Okay, first I'll give you an overview of what we created before diving into the specifics of the methodology. We built an interactive map-based tool that we call the Food Insecurity Index that shows the likelihood of food insecurity by census block group. If you're not familiar, a block group is a geographic designation from the census. It's about the size of a neighborhood, typically not larger than a few thousand people. We created the Food Insecurity Index first for the county we primarily serve, which is Mercer County in New Jersey, in November of 2022. Following the first version's success, we connected with our state office of the Food Security Advocate and received funding to update the tool and to expand it to 2 additional counties, Middlesex and Somerset. These are neighboring to Mercer. The Tri-County version of this tool, which was published in October of 2024, is what Em will share with you in a few moments. In creating this tool, we really wanted to prioritize accessibility, interactivity, and actionability. We didn't want this to be just an analytical exercise, but to be something that was actually useful for the community and is actually used by the community. Next slide, please. Thank you. So with that in mind, the first step that we took was to create a steering committee that was involved in every step of the process. We convened a group of local stakeholders across the 3 counties. So for the Tri-County version, again, that was Mercer, Middlesex, and Somerset. We wanted all of them to be represented. And we met regularly with them to make decisions on everything from which variables to consider for our index calculation to the final details about the functionality of the tool. We started with a list of over 25 variables that were relevant to food insecurity. These came from a literature review of similar analyses and from suggestions from our steering committee. We prioritized publicly available data so that this index could be sustainable and updated on a routine basis. We used correlation analysis and principal component analysis on our initial list of variables to understand the relationships between them and see which ones were highly correlated. Those analysis results were brought back to our stakeholders, and through discussion, the group determined the final 11 variables to use for the score calculation. These 11 variables fit into 3 key themes, and you can see those listed on the table on the right. The 3 themes are measures of need, measures of access to food, and demographic measures related to someone's ability to access food. The 11 variables were combined in linear combination with their weights determined by the steering committee, and a score was assigned to each block group. The scores were normalized over the entire state of New Jersey from 0 to 100, and a higher score indicates a higher likelihood of food insecurity. Okay, next, please. So we know that not all food insecurity looks the same. So we wanted to provide an even deeper dive into our score that could give insight into particular challenges or barriers in an area. In our first version of the tool from 2022, we used cluster analysis to group areas based on their characteristics, aiming to minimize heterogeneity within groups but maximize differences across groups. This worked well on the small scale of just 1 county, and our stakeholders were able to use these characterizations to guide their resource planning. However, when we tried to replicate this process at a larger scale with the 3 counties, we found cluster analysis to be too restrictive. Expanding to more areas meant expanding the differences between block groups, and no cluster solution seemed to hold the practical significance we were aiming for. So through discussion with our steering committee, we decided to take a different approach. There were several key questions about the data that kept coming up again and again, and we used those to create what we call segments. Our segments are essentially specialized views that highlight different aspects of food insecurity. You can see these in the table on the right, and the intent of all the segments is to make the tool more usable by outreach teams and program planners. So one example is our SNAP underutilization segment, which combines a block group's food insecurity score, poverty rate, and SNAP enrollment numbers to spotlight areas where there may be underutilization of SNAP resources and areas that could be good locations for SNAP outreach. Another example is our single parent segment, which looks for areas with high food insecurity scores and high rates of single parent households. We've heard from our partners that this population has unique needs, and so organizations might want to adjust for their needs by co-locating resources in areas parents already visit, such as schools or libraries. Now I'm going to pass it over to Em to show you what this tool actually looks like.
There we go. Thanks, Kathleen. So this is where we really start connecting the data to real-world action. So these segments weren't just academic, they came, as we said, from community conversations. So for example, if you're planning a distribution event or designing outreach for, say, older adults or people without cars, the segment data helped you pick the right places, time, and messaging, and perhaps even strategies in terms of how you're outreaching. So let me show you what this looks like in practice. Here is the landing page of our tool. When someone enters here, they can flip through the bubbles and learn a little bit about food insecurity and what it means, and a little bit about the tool and our background. We have the 6 dimensions of food security, and it goes into all of these: availability, access, utilization, stability, agency, and sustainability. So our whole index is really on the demand side, not on the supply side, in terms of how we're defining who is experiencing food insecurity. So this was really helpful in sort of attributing those lenses. We have the About the Index page, which goes over a lot of the background that Kathleen already mentioned, from our initial inspiration to the modern tool, and our big guiding questions, which was where to focus and what to do. And honestly, these questions can really be applied and utilized for any kind of spatial geography question of, okay, you have a problem, where is it, what are you going to do? So that was a great foundation for that. Provide some context of the where, block groups, and the previous variation. Here we have our methodology in more detail, and we will be sharing this out. So basically, we kind of explained how we worked with the steering committee, how we reduced the amount of variables and the various equations used, etc., and a bit more about the segments. So let's get into the fun part of it. This is the Tri-County version: Mercer, Middlesex, and Somerset. Each block group is shaded by its composite food insecurity score, built from those 11 variables from the 3 themes mentioned earlier. So let's click into a block group. So the pop-up shows the score itself, plus the breakdown and any relevant segments, such as this one falls into SNAP underutilization, limited English proficiency, and single parent, top 10% of the state. It also then shows the individual scores for each segment. There's some additional information as to what municipality it's in, the population, household number, and then we get into the actual percentages for those 11 scoring characteristics mentioned before. So if you were really just interested in that, you could look at that data. We've also included additional characteristics. These were derived also from American Community Survey, as well as CDC Places. These are different demographics and health characteristics that may affect how someone reaches out into a specific community, or different types of combined outreach, say if you're doing something that's diet and health. So really, we just wanted to provide as much context as possible so this could be as usable to our stakeholders as possible. So This is not just like a map you can scroll in and out of and click. You can actually filter, explore, and export that data. So let's take a look at that. Here you can export it as a CSV, JSON, or GeoJSON, so you can do your own analytics. But if you want to stay within the tool, you could say, look at total population, and it will give you some basic statistics for these areas in terms of that, minimum, maximum, average, etc. But that's not even the cool part. So let's go into setting up filters. So say, for example, you're looking into something really specific and you want to see the percentage of households that are housing cost burden, but specifically between, let's say, 30 and 60%. And you also want to see the areas where poverty is greater than 30%. So you can put these into the filter, click this little toggle, and now it'll just show you the block groups that meet those characteristics. You can add as many of these filters as you want, and you can use and or logic. When you click in, it will then show you the same pop-ups as before, and if you were to export the data, it would be to this filter. So this is great if someone wants a curated view that's maybe not specific to a segment, or maybe you just want to see places that are in the top 10% of a segment, but also have a specific other attribute. So in this example specifically, this combination tells us something really powerful. These are neighborhoods. Let's see if I can, yeah, I can stick it back on. There we go. These are neighborhoods where housing instability and economic need are overlapping. So that would help providers identify communities at high risk of food insecurity, even if they're not the worst off yet. It's a way to act early and direct resources strategically. You can then look at the segment scores individually to see information about them. So in this case, this is the SNAP underutilization segment. The darker polygons are areas that have a higher SNAP underutilization score. If you flip here, you can see that for every single segment. They each have their own color gradient, and you can use that to inform decisions. So you can use these to highlight areas that might have specific needs based off of popular criteria used by our stakeholders and define it further. You can actually filter within these segment views as well. So from data to action, here's an example of how the tool moved from map to impact. We worked with the local food banks to map every free food site, what they offer, their hours, capacity. And then when we overlaid the index, went back one, we immediately saw gaps, places in high need, but no nearby services. So let me pull this up. So this shows various pantries and meal sites. So once we saw gaps, for instance, in West Trenton, where there was high food insecurity but not so many resources, people were able to take action. This led to deploying mobile pantries to fill these gaps. This has also shaped larger decisions like where to site food hubs, where to run surveys to learn more about cultural food preferences, and eventual brick and mortar decisions. So beyond just that food finder map, this data becomes even more powerful when layered with other local sources. For example, pairing the index with school lunch program enrollment can highlight areas where children may be missing meals on weekends. Or if you have access to that data, overlaying local ER visit data, or chronic health disease registries, or even housing assistance, applicants can help uncover intersections between food insecurity and broader social determinants. And part that's fun for me is we can also bring in spatial techniques like calculating service density or travel distances to resources. This can help us understand who's effectively reached and who isn't. Or we can layer in other indexes, like housing vulnerability, climate risk, social determinants of health, ALICE data, etc., to identify neighborhoods dealing with compounding challenges. This kind of layering lets decision makers move from reactive programming to proactive and holistic planning. So instead of just asking where food need is needed today, we can start to ask what else is shaping those needs and where interventions could have the greatest ripple effect. So this project wasn't just built for the community. We talked about our stakeholders and steering committee earlier. It was really built with them. Stakeholders help choose the variables, adjust the weighting, and even test the tool's layout. That feedback made it clearer, more relevant, and easier to use. And most importantly, it built trust. People see themselves reflected in the tool, and that's why they keep using it. It's not just this nameless indice where they don't know where the numbers came from or how reliable the data is. They got to participate in making it. I can't tell you how many times I've said participatory GIS in the past year, and it's been fantastic. And I can't imagine making a community tool any other way going forward. So one of the biggest wins here is that this approach is replicable. Everything we used, ACS data, various geospatial tools. If it's not publicly available, it's at least something that you can get a license for. A lot of what we've done while we did it in ArcGIS Experience Builder could be translated to something like QGIS or Mapbox or other tools that perhaps have more accessibility. So if you're working on housing, overdose prevention, climate vulnerability, anything place-based, this same framework can be reworked to fit your needs. Change the variables, adjust the weights, and you've got a local actionable tool. So what's next? We are currently scaling statewide. We have a goal to launch at the end of June. That includes building out new county level models and starting to track how things change over time. One of the big things people requested was, well, how is food security now versus then? How will it be in the future? So by using this publicly available data, we are able to update it regularly, and we are able to record those updates in such a way that we can watch as our communities evolve over time in terms of food insecurity. So additionally, we'll be adding more segments because now it was complicated enough adding segments when we were looking at 3 counties. Now looking at the entire state and everyone's specific needs and interests and goals, we want to have a tool that's still usable by anyone. So we're really trying to collaborate and make something usable. So this lets us, not only respond better, but evaluate what's working by having these repeated iterations. This tool is meant to grow with us, more or less. So here's what I want to leave you with. Food insecurity is multifaceted and structural. It's not just about empty fridges. It's about transportation, housing, wages, and policies. It's embedded in systems, and we have to treat it that way when we plan. It's more than just the number of calories, it's access to healthy, sustainable, culturally available food. Next, public data plus local knowledge gives us powerful insights. Neither one is enough on its own. There will be gaps if you rely completely on the numbers or completely on community feedback. But together, you get something that's both rigorous and grounding, which is something you can actually act on and influence policy and change. Participatory tools drive better decisions. We made better choices because we built this with community input. There were blind spots we would have had that experts in the field of food security knew about, and there were things that they could better understand because we were able to explain our process behind it and make sure that we had it in a way that we could convey to all sorts of audiences and make this tool accessible. Partners adopted it because they saw themselves in it. This is scalable. You can start with your community's data. You don't need fancy licensing or proprietary sources. Public data and lived experience are enough to start making real change right where you are. You don't have access to a mapping program? Well, first off, if you reach out to me, I can tell you about a bunch of free ones and open source ones and ones that have community support or nonprofit licensing. But You could start with a spreadsheet. You could, start in a Google sheet if you don't even have Word and start looking at this data. I mean, we started with a bunch of CSV files. That's how we downloaded it. It was tabular. We turned it into something spatial. You don't have to in order to make a change. So this is a good spot where you can just start however for whatever your topic is. So you can explore the Tri-County tool at the link on screen. And if you're interested in building something similar, whether around food, housing, or health, please feel free to reach out. We're happy to share our methodology, lessons learned, templates, etc. So, don't be a stranger. Thanks so much, and we're looking forward to hearing your questions.
Thank you so much. This was such a great presentation. As Em mentioned, it is question and answer time, so feel free to unmute or put any questions in the chat if you have any. It looks like we'd love to hear a little bit more about GIS resources. Do y'all have any that you could share?
Yeah, so there's a couple of ways you can go about free GIS resources. First off, if you are a nonprofit or a student, ArcGIS, and Esri will offer you the actual Esri suite at a pretty severe discount. And often if you reach out to them and talk to them, talk about your use case, they are willing to work something out. So I I have to say I normally don't have great things to say about customer service, but I've had a great time working with theirs. If you just want to stay away from proprietary in general, QGIS is great. Um, Absolutely fantastic for you can do pretty much everything you can in Arc Online. There's now more community server-based options for QGIS. So as you get into it, you can look, it's a little bit more complicated to make an online application like this, but there's so much community involvement on various forums that if you have a question of how to make it done, the community will come together to help you do it. Um, Other applications, Mapbox is pretty great for anything you're doing visually. You don't need so much GIS experience to make that work. If you're more on the analytics side, you can do basic maps in Tableau. And finally, I have no idea if it's going to eventually be deprecated, but Google My Maps is a very simple way if you use an online website or something to convert your CSV into a KML. You can do a lot of things within Google My Maps just for basic visualization. You won't be able to do any analytics. You won't be able to have any fancy pop-ups or anything like that, but you can at least see how it looks on a map. Um, and there's always new things coming out with people coming up with ideas for various mapping software and ideas.
Awesome. Thank you. I have a question. With kind of the changing landscape with data reporting, how do y'all plan on navigating kind of some of your data changes?
Do you mean in terms of data accessibility?
Yeah, so like some counties are stopping reporting in certain areas, or some counties are like upgrading. How do you guys plan for that to like impact you?
So because we're working with the American Community Survey data, and to my knowledge, New Jersey doesn't have any plan to stop reporting in our specific use case, we can continue using ACS. CDC places data may become complicated as time goes on. If that happens, what we may need to do is either talk to local health resources, et cetera, and sort of draw our own index from that, or that might be something that we just don't have as a functionality as the tool because that has always been sort of a additional add-on rather than a core function in terms of the data that's available. But in general, I mean, we've done our own food surveys. We are very involved in our community's health information exchange. Obviously, there's limitations with that data because you really need to aggregate it and clean it up to protect privacy. So work with what you've got. And nothing wrong with community data collection.
Yeah. How do y'all incentivize people to fill out surveys? I feel like I really struggle with that in my everyday life is getting people answer a survey. No one wants to do it. And that's really fair.
Well, I mean, we've had some success with offering incentives. So whether it's a gift card or like a raffle for a gift card, I feel like that at least helps to have people fill it out. And also just keeping it short. Like there's always so many questions you want to ask, but really once it starts getting past like a few questions, people drop off. And we all do it, So um, I feel like the most success we've had with surveys is actually like in person. Like we've done some surveys about food insecurity in our community, and the most responses we get is if we like actually give surveys to some of our partners and they promote it at their organization, or whether that's a QR code or a physical copy. We ran a countywide survey that was through postcards, and that was, we got some responses, but it was a very low response rate. So I feel like the in-person is always going to work out better and having an incentive.
Thank you.
To be clear, did you or were those sort of surveys and stuff like that? Was that kind of meant to be like validation to see, how this food index was working and if it was sort of matching what you guys were seeing on the ground?
Yeah. So thanks for
Well,
saying that.
okay,
We
yeah,
we
go ahead.
sent out the survey that we really did for like that validation piece was throughout the whole county, and we used our index to oversample in areas that we had recognized as higher likelihood of food insecurity. And we saw that the results, once we, got the responses back and accounted for oversampling and everything, we saw that the results pretty much matched what we had modeled. So that was great to see, at least that, it was at least directionally accurate. Um, and yeah, so that was the intent behind that. And hopefully we'll do some more surveys in the future because I feel like that's when you get the best information, especially for something like food insecurity, where there's really not a clear-cut measure. This tool is us trying to make a proxy for measuring it, but the only way is really just talking to people. So yeah.
Right, right. Can I ask, were there any areas that you were really surprised were labeled high risk food insecure or else not? Any sort of things unexpected that you guys saw?
So, I mean, we did have a couple places where we're like, why is this so high? Or, why is this number so different than the ones around it? That often was attributed to low population. We did decide to disinclude any block groups that had less than 100 people in the creating the composite. So basically, we'd be like, why is this area has no houses? Why is it like this? And it's like, oh, there's a nursing home here. So, you'd find information like that. Otherwise, when we were meeting with stakeholders, we definitely had some feedback where people said that the index didn't match what they saw in their community. And that would generally come from the fact that the American Community Survey completely randomizes who it asks. It's a subset of the population, so you can lead to populations getting missed. But all in all, I'd say, it reflected things the way people were expecting it to.
Yeah, I feel like that example that you just said with like finding a location where there's a nursing home or senior housing was something that if we were just working on this on our own, just as data people, we would probably say, maybe this is just an anomaly and we don't know what this is for and maybe discount it. But because we kept coming back to our group of people who are local and working in this space, they're like, wait a second, I know that area and I could tell you that this is this. And that was actually helpful for them, they said, because that would be an area they wouldn't necessarily think about doing outreach for, but maybe something like a Meals on Wheels type of organization might want to add more outreach to that area. So there were a couple things like that, yeah, where it was like, why is this showing up so high?
Is there any other questions? Feel free to come off mute or you can put them in the chat.
Well, I'm so impressed with the amount of sort of engagement that you guys did with the community at every level of this program. And particularly from my experience, I know meeting with stakeholders can be so hard in those early planning stages, because the community has lots of different opinions and sometimes they disagree with each other. Were there things that steps that you guys took to ensure that the sort of stakeholders that you met with were representative of the community, or other ways that you kind of handled disagreements or issues with that for your stakeholders?
And
So
I'm thinking of your survey. Yeah.
yeah. So we actually wound up doing regional in-person convenings where we showed a demo of the tool and asked for feedback. We did a survey online where people could then, additionally, if they didn't feel comfortable talking at the meetings, give that feedback. Because we did it regionally, there wasn't really, I'd say, conflict necessarily. If anything, people tended to feed off of each other and get more excited about the various just rocket ship level things they wanted implemented in here that were so far outside the scope of our possibility for this iteration. And, I think overall people were very positive. No one really argued with each other. Everyone just sort of was like, yeah, that's a good idea. Also, I have this good idea. But some of that may be the fact that we did do these regional meetings. We did, what, 6 of them total, Kathleen?
Across the state,
Yeah,
yeah.
across the state in different areas, including one virtual one. And then we had the feedback survey that they could choose to include contact information or not. And then at the end, we aggregated all this data, the survey data, and then the notes taken at the actual meetings, and used that to inform our decisions going forward in this iteration.
I see. Interesting. As you look to expand, are there any things you would change with doing that in that sort of process, or are you pretty happy with how that came out?
I feel like that worked pretty well. I mean, we haven't, yeah, as we're working on the statewide version, obviously we haven't published that out yet. So I guess we haven't gotten like tons of public feedback on it, but I feel like it worked pretty well for the reasons Em just said. Like every area kind of had their own key things that were coming out of conversation, and they were different a lot of times because there's more areas that are more like rural or more metropolitan. So I felt like doing it regionally was helpful to get that perspective, and we're try to incorporate like all of those pieces as we're making the new tool. um, I don't know if you have anything to add, Em, but I thought it went pretty well doing
Yeah,
that.
I thought it went well, and I think the fact that at the very end we had an all-inclusive virtual meeting was great too, because we were able to capture voices we would have otherwise missed, or people who are incapable of attending in person for whatever reason. And I think having that would be good. If anything, I might have made 2 virtual sessions, maybe one towards the beginning, one towards the end, just to capture more voices. But I think in person was fantastic too, because people would start talking and then other people would kind of chime in a way that you can't really capture quite as well in a virtual atmosphere.
Totally. Cool.
Plus, we had free lunch for everyone, so I think that maybe motivated some people to show up.
That's always a really great incentive. Awesome. I think if there's no other questions, is there anything else y'all would like to share before we kind of wrap it up? Great. Thank you so much, everyone, for attending. Here we have a few short announcements before you head out. Slides and additional handouts the speakers have provided are available on Sched. Here is the QR code to our conference evaluation. You will also receive a conference evaluation form via email after the conference is over. As we just talked about, surveys are very important into giving feedback and the success of future events. So please fill out that about, even if you've only attended a portion of the conference. Really helpful for our planning committee. If you've enjoyed this conference, we encourage you to check out Public Health in the Rockies, which is a great event also put on by the Colorado Public Health Association each year. So you can check it out at the website. It's at coloradopublichealth.org for more information. The recordings will be live next week, and we will follow up with an email when those are ready. Thank you so much for supporting CPHA and for joining us for these sessions. We hope you had a great couple of days connecting with other public health professionals, and I hope you have a great weekend.